everyone, we are here with a patient for a very prominent protruding chin. So you see the chin here. His main complaints remains that he has always been very conscious of the fact that he has a chin which is, so as to say, sticking out. If he turns on one side, so we can very well see along his facial profile that his chin is outwardly turned in a very acute fashion. So that is the reason he is getting a deep mentolabial sulcus. So if you look at the facial profile, we see there is a deep grooving, something called as the deepened mentolabial sulcus here. He's always been very conscious and ridiculed about this fact. We've seen his scans as well, and that's also because his lower third of the face has decreased height. So whenever he smiles, there is no display of upper incisors. That's also his complaint. So he wants a chin which is proportionate to his face, and that can be achieved with genioplasty. So genioplasty not only helps in augmentation but also in reduction. But yes, he does need a little bit of vertical augmentation, and yes, obviously horizontal reduction. So it's also a muscle which has a role to play, because he doesn't have the desired vertical height. So the muscles have only draped around the short chin that he has. So bony, or as we say, the hard tissue component is actually very minimal. It's the muscle and the soft tissue component which is having a bulged up appearance here, and that's giving his chin a very protruding appearance in a very acute manner, hence resulting in a crease or the mentolabial fold. So he's come from very far off, traveling a lot of places, covering a lot of distances for us, and he's in a very short break, and he chose to spend it because he got that appointment in this particular slot. So it will be a genioplasty, and we can see that how marked a difference a genioplasty can make to the facial profile, especially to the lower third of the face. आप कुछ बोलना चाहोगे सर?
नहीं, खुशी है।
हाँ?
पहले तीन साल से मैं फॉलो कर रहा था यूट्यूब पे।
ओके।
तो वहाँ किसी के और पे मैं जाकर मैं सीधा इधर ही आ गया।
इधर आ गए। बट आपको यूट्यूब वीडियो इन्फॉर्मेटिव लगता है सर? यू फील की
क्योंकि जो मेरे साथ जो है अभी जो चीन है, इससे मैं 2-3
और लोगों को जानते हो। हाँ,
बट उनका रिजल्ट भी देखा है।
हाँ,
तो पता चला कि अपना भी हो सकता है।
राइट, यस। बिकॉज बहुत लोगों को डाउट होता है, बट कहाँ जाना है, इसका ट्रीटमेंट पॉसिबल है क्या, उनको पता नहीं होता। तो काफ़ी टाइम थ्रू वर्चुअल मीडिया हम लोगों को मे बी मेक बिलीव सॉर्ट ऑफ करवाते हैं कि इसका ट्रीटमेंट पॉसिबल है, आप आ सकते हो, यू कैन रीच आउट टू अस। बाकी आपने एक और कंप्लेन बोला था कि आपकी दांत बहुत कम दिखता है स्माइल करते वक्त, वो भी एक प्रॉब्लम है, क्योंकि आपका जो लोअर थर्ड ऑफ द फेस में अगर आप लाइन ड्रॉ करते हो ना सर, वो छोटा है आपका कंपैरेटिवली। यस, मैक्सिला का हाइट छोटा है, इसकी वजह से आपको ऐसा भी लगता होगा कि थोड़ा सा एजेड लुक दे रहा है, क्योंकि अंदर की तरफ है, दांत नहीं दिख रहे, स्माइल यस वो लूज है। अगर थोड़ा मैक्सिला का हाइट ज़्यादा तो वो स्ट्रेच दिखता है। दैट इज़ अनदर डिफरेंट, कम्प्लीटली डिफरेंट कॉम्बिनेशन, ये भी हमने आपको बताया। बट करेंटली सिंस आपको अभी सिर्फ चिन करवाना था, यू वांटेड टू गो ओनली फॉर दिस, ऑल्सो आपके पास छुट्टियाँ भी कम है। यस राइट, तो इस बार हम आपका चिन करेंगे, पर वो ध्यान में रखना कि येस दिस इज़ ऑल्सो अ थिंग विच कैन बी ट्रीटेड। ठीक है, ओके, थैंक यू।
And this is how he's right now. It's going to reduce a little bit more the protrusion because the soft tissue has just been detached and we've put it in the new place. Take a few weeks before it gets adapted, and we're going to show you how he looked before. There you see how big that chin was. So this was like really protrusive chin in the horizontal dimension, and that's him now. So we've basically corrected the over projected chin in the horizontal dimension, and we have increased the shape also, or contoured it. Right, we're going to show you the front view. Again, you can see that how that was, and that's how he's right now.
Hello everyone, greetings from Richardson Hospital. Here we have with us a patient who has come all the way from Rajasthan, and he had come to us with a protruded chin, and his chief complaint was that the nasolabial fold you see here, it had a very deep grooving. He wanted to reduce that. As you see here, you can appreciate as compared to this picture, maybe a lateral view would do more. You can appreciate this grooving which is here is very deep. The chin was very much protruded, and if you compare this up in the lateral view, if you see, the chin here looks very short and very protrusive. But now what we have done is we have done augmentation as well as reduction. So the reduction was done in the horizontal plane and augmentation was done in the vertical plane. So we have done a vertical augmentation genioplasty where we have increased the height of the chin by 7 mm and reduced it in the horizontal aspect. So the outcomes or the goals that we wanted to reduce this fold, and we wanted a lengthier chin that we have been able to achieve. So now we are it's post-operative day 5. We are going to remove this dynaplast right here, which we put to reduce the edema that occurs post-operatively. This is an adhesive remover spray. So it helps to आँखें बंद करो. Many patients complain that they have a lot of pain when we remove this. Oh. एक सेकेंड ना, आँख बंद करो. Yeah. So we are just removing the dynaplast here with the help of a adhesive remover. With the beard and the mustache or whatever the patients have with all the hair, it becomes easier to use this and remove. Okay. Okay. Now to the other side. आँख बंद करो, आँख में जाएगा. So आप अभी ये मिरर लेके देख सकते हो. So this is the first time he is going to see his face. थोड़ा मिरर नीचे पकड़ो so that we can show the viewers. आपको कुछ बोलना हो तो बोल सकते हो. आप खुश हो?
हाँ, पहले से बेहतर है थोड़ा सा.
बेहतर है.
हाँ,
आपका जो हाँ डेप्थ था वो कम हो गया, और ये मैं सब साफ कर लूँगी. आपको चिन ऐसे ही चाहिए था?
हाँ, बिल्कुल.
So that's what the patient tells us. This is the chin he desired, and he is very happy with the surgical outcome that we have achieved. So one last time, let me show you the pre-operative. This is the worm's view. सीधा देखो. This is the facial profile, deep mentolabial groove.
More closer to the ear. Yes.
एंड थोड़ा साइड में देखो, दिस इज द लैटरल व्यू. Okay, signing off from Richardson. Thank you. I think we're done, no? Yeah, done. Nothing else.
Now it's perfect, yeah. Without those.
LC5 हो गया. चलो अब जा सकते हो ऊपर. एक और बार देख लो. आपको कुछ बोलना है? आपका एक्सपीरियंस कैसा रहा यहाँ पे? अच्छा था?
हाँ,
सर कैसे?
बहुत था, अच्छा था.
सर ने आपको
टीम भी बहुत सपोर्टिव है, स्ट्रांग टीम है, पूरा ध्यान देते, पूरा 24 घंटे ध्यान देते. अच्छा है.
ठीक है. थैंक यू.